Hey guys, Aileen here. I apologize for the hair. It's still drying and it's got a mind of its own day, so let's just ignore that. And today's topic, I'm going to be talking about birth control and why that may or may not work as HRT for you. So I know that a lot of you guys in the early menopause, premature menopause community are trying to have kids. So with that being said, if you are trying to get pregnant, birth control is not going to be a great option for you for the obvious reasons. For those of you who are not trying to get pregnant, I can almost guarantee you that when you go to your doctor and you are complaining of hormone issues, sorry, I just had some guacamole and I think I got some on my lips still. There we go. When you are complaining of hormone issues, the very first thing they're going to do is put you on birth control. I think that's because it is the most readily available. It's the one that doctors know the most about, and it is pretty controlled in that you don't have to figure out levels, you don't have to take a test first. It's gonna pretty much work with just about anyone. It may not, the first one you get put on may not work for you, and you might have to switch to another one. You may have some short-term side effects when you're going on it, but for the most part, birth control is an acceptable type of hormone to put in your body. So for me personally, when I went to the doctor a good 3 years ago, after going through 3 years of hormone issues already, because I had to realize that's what it was, when I presented my list of symptoms and the timeline and it complained of what I was dealing with on a daily basis, birth control was the first thing that was given to me. For me, it did help tremendously with the emotional and mental issues that I was dealing with, which would be brain fog, forgetfulness, and a lot of just not normal thinking for me. And the birth control was great for that. For some of the physical issues, hot flashes, night sweats, no libido, extreme fatigue, can't sleep, all of those things were unaffected by birth control for me. So if you're like me and you have a lot of physical symptoms that you're going through as far as the hormones, birth control may or may not help, just depending on who you are in your body and your chemistry and what you're lacking. It's a great thing to start with, because for some people it's going to address all the issues you're dealing with, and that is where you can stop, and that is great. So happy for you, and I wish I was one of you. For the rest of us, there's the option of going natural, which we'll talk about in a different video, or going on HRT. And experts tend to say that the younger you are as you go through perimenopause, the more important it is for you to go on HRT. For the typical woman going through menopause between 45 and 55, they're going to maybe have 20 years without that estrogen in their body. And with that comes risks, but 20 years isn't bad. If you're going through it in your 30s or your 20s, that could be 40 to 50 years without estrogen, and the body really isn't meant to go that long without such an essential hormone. Let alone, we're not even talking about the progesterone and the testosterone and all the other things that your body will be lacking as it goes through perimenopause and then from menopause on. So the hormone replacement therapy options for us, for those of us who have the physical symptoms and have decided the route that we want to go, is HRT. There are a couple of options. The first one being a transdermal cream. And this is the lowest level of hormone replacement therapy. These can be purchased online on Amazon. Actually, I do have some. Let me get them. Oh, this one and... well, I have a couple, but I can't find the other ones. This is my estrogen. And I put about 3 milliliters of this a day on my arm in the morning and in the evening, and I just kind of rub it in. This helps with the itchy skin. It helps with the hot flashes and with the night sweats, but it really, it's transdermal. So it metabolizes into the body completely differently, and it's a really, really low level, which is why it can be purchased over the counter. The longer you take a transdermal cream, the more your body's going to get used to it, and then you're going to have to up it every time. You're going to have to increase the levels to maintain the same results. So transdermal creams are a great place to start, especially when you're just starting with your hormone issues. Before you have to dive into something really serious, it's a great place to start to try to figure out for yourself what the symptoms you're dealing with are caused by. And you do that by just basically experimenting. Let's say you have a specific issue and you start using the estrogen cream and that issue goes away, then you know that that issue was caused by a lack of estrogen in your body. There's also progesterone, DHEA, and testosterone creams. Progesterone and DHEA can also be purchased over the counter, but testosterone is a controlled substance, so it's going to be needed to be prescribed to you, usually by a gynecologist. And even though they're very reluctant to diagnose anybody under the age of 45 with menopausal issues or perimenopause, they are actually usually pretty easy to get a prescription of testosterone, especially if you're dealing with a loss of libido, because testosterone is known to be a contributor to libido. So I have a prescription of testosterone. It comes in oral syringes, and I take a 0.25 milliliters of it every day, and it just goes on my wrist here, and I rub it in. For me, it did not help at all with my libido, but it did help with fatigue, and it actually helped me lose weight. Not a lot, but when you're smaller in frame like I am, a little bit of weight makes a huge difference. So if you're dealing with any issues really, and the progesterone or estrogen or DHEA has not helped, I would recommend asking your doctor about a testosterone cream as an option. Now, if you've already looked into the creams and they're not for you, there are still another few options. There's the patch, which is going to be, I think, estrogen by itself and progesterone by itself. There might be a combination of the patch as well, but this is not going to be ideal for those who have sensitive skin. I myself have very, very sensitive skin, and so this wasn't really an option for me, as well as the fact that I'm really, really low in testosterone, and they don't offer a patch of testosterone, so I would still have to do something else for that. So that brings me to the next option, which is the pellets. This is an interesting one. It is a very small form. My doctor described it to me as it kind of looks like a grain of rice, but a little bit bigger, and inside it is the medicine. That little tube is inserted underneath the skin on the hip with a small incision, and then it stays there for the next few months, anywhere from 3 to 4 months, depending on your size and your body and how it metabolizes it. You can get just estrogen, progesterone, or estrogen, progesterone, and testosterone. And anytime you go into something major like that, there's going to be testing beforehand. So you can either go to a doctor who specializes in hormones, and they will administer a test. They're usually going to send it home with you, and it's either going to be a blood prick or saliva or both that you're going to have to collect and then send in. Once the test comes back, they're going to look at your levels and decide where to start with your levels, and then basically it's just trial and error to see how you do. No matter what option you choose as far as hormone replacement therapy, there are going to be side effects, even if it's just the creams. Most of the time the side effects are going to be similar to what pregnant women go through. When you're first introducing estrogen, a lot of times you will experience nausea, sometimes an increased bladder function, breast tenderness, basically anything you would experience throughout the first part of pregnancy is what you're going to deal with with estrogen, and it will go away once your body gets used to that amount. But just to let you know, all of those things are possibilities of side effects. Most of the time they're not permanent. Most of the time they're short term. So I don't want you to start a specific type of HRT and then just stop because you're not okay with the side effects. Because the side effects will go away. And yeah, you just gotta be patient. So I hope I've explained this well. There may be other types of hormone replacement therapy other than the oral pill or other kinds of birth control, because I know there are other kinds of birth control. But I'm clumping all birth control together because it is going to be a low level. And the other problem with birth control too is if you're going through birth control while you're in perimenopause, there's not really any way of telling when your body is stopping bleeding. So you won't really know when you've reached menopause, which is identified as 1 whole year without bleeding. You're not going to know when you've reached that point because birth control is always going to give you that withdrawal bleed, which is not an actual period. It is a manufactured side effect of the birth control. So for me, personally, I would recommend birth control as an option at the very beginning of your hormone imbalance journey, maybe for a year or 2. And then if you are not experiencing side effects, I think what they recommend is to go off birth control for at least 2 months and then test your hormones to see where your levels are at. And if you're still low level, like if you're not at menopausal levels, then you can continue your birth control. But if you're like me and you're dealing with a lot of side effects and you're still fairly young, I'm 36, so I fall in that under 40 bracket. This all started for me when I was 30. So for me, it is not something I'm willing to go through for the next, 20, 30, 40 years without. So I will be going on the pellets at the end of this month, actually about 2 weeks from now, and I will be documenting my journey. I will let you guys know how it feels to get them inserted, how I feel the first day, the first week, the first month. I'm going to walk you guys through the process. So if you're interested in that, please stay tuned. Feel free to subscribe to the channel. And if you want to talk about a certain subject, drop that in the link or in the comments below, and I would love to do some research and make a video just for you on that topic. So hope you guys are doing well, and I will see you in the next video. All right, bye.